time. First, though, smoking, and this has really got people talking. MPs are going to vote later on the Tobacco and Vapes Bill, which would make it illegal for anybody born from the January of 2009 to ever buy cigarettes. Dozens of Tory MPs, we're told, are likely to vote against the proposals, but the legislation will pass because Labour are supporting it. Jack Rowlett is political commentator with Young Voices UK. Hazel Cheeseman is Deputy Chief Executive for Action on Smoking and Health. Jack, Hazel, good afternoon. Welcome to the programme. Can we start, Jack, with your take on this? Surely this is the right move. Yes, of course, there are going to be problems. Of course, people born in the January of 2009 will be able to ask their mate who was born in the December of 2008 to buy them fags. But it's a good starting point, isn't it?
Well, I don't think so. Look, we know from that prohibition doesn't work. Now, the government is trying generation through laws and enforcement when, not for want of trying, Britain has made next to no progress on creating a cannabis-free generation or an MDMA-free generation. For example, why, when we've been unable to kill the demand of other substances we've banned, why will cigarettes be any different? Now, I think people who want to smoke, there will always be a proportion of the population who want to consume nicotine, who want to smoke. And actually, methods need to be focused on public health because that's where we've seen success in recent years. That's how we've managed to cut the rates of smoking so much compared to the rates of drugs that we've tried to cut the usage of, because we've been pursuing public health measures to try and cut smoking, where we've been pursuing enforcement measures to try and cut drugs. And I think what's even worse about the legislation we're seeing today is it goes beyond just smoking cigarettes and is actually cracking down on the healthier alternatives like vaping, for example, by making those products less attractive, by limiting the flavours, by introducing plain packaging, when actually, if we want to be creating a smoke-free generation, we need to be encouraging more people to take up those products and be making them more attractive.
Jack, thank you. I've got the feeling Hazel won't agree, but Hazel, take those points on. What do you think?
Well, I think that the question about prohibition, prohibition never works, is I think the first thing to address there, because we're not talking about something that is prohibition in the way that drugs have been made illegal, or the prohibition of alcohol in America in the 20s. This is quite a different thing. This is a phasing out of the sale of this uniquely lethal consumer product, a product that would definitely not be on the market if it was discovered today. It's not about prohibiting the sale of these products to people who are already consuming them. We have, 6 million addicted smokers in this country. And absolutely, if you were to ban the sale of those products to that population, I tend to agree. I think it wouldn't work. But we're not talking about doing that. We're talking about phasing out the sale of tobacco to a population who currently, smoking rates are negligible in this population, and we need to keep them that way. And I think the point is that we are not banning the addictive component of tobacco smoke completely. Vaping products are not included in this proposal to phase out the sale of tobacco. Tobacco products are being phased out, not nicotine. So nicotine will be there, and perhaps the other contributor is correct. Perhaps there will be a population of people in this country that consume nicotine. I mean, that kind of remains to be seen. But that safer alternative in vaping products will be available to people to do that if that's what transpires. So I think it's very different from characterising it as a straightforward kind of prohibition.
Yeah,
it's a different thing that we're looking at here.
I wonder, Hazel, what you make of the argument put very, very forcefully by certain so-called libertarian MPs who really do believe that the government just has no place in these areas of our national life. And in fact, it is up to us to decide what we do to and with our bodies.
So the role that government has is to protect the population from harm. And the harms that are being perpetuated to the population are because there are companies that massively profit from the sale of this addictive and lethal product. That is what the government is doing, is intervening to protect the population from if there was no profits to be made from the sale of tobacco, I suggest there wouldn't be that many people smoking today. They wouldn't have had the products promoted to them. They said, why would you be consuming them? Well, so the role of government is to protect people from the harms that are being done to them by these big industries.
Yeah, I mean, Jack, a lot of people don't like it, but I think that there is evidence to suggest that most people in this country rather like the government looking after us, looking out for us, and issuing gentle and sometimes rather stern warnings about what we should and shouldn't do. Why do people want to smoke this horrible, addictive substance that, as Hazel points out, is making billions in profits for capitalist giants?
I think that the problem is that, you may not like smoking. I don't either. I think it's disgusting and bad for you. But actually, if we allow the government to dictate what adults can and can't do with their own bodies, then the next thing that they decide to ban on public health grounds may well be something you or I enjoy. And I think that's the big problem with this. We look at prohibition, and actually, I think this is prohibition, really, because there are entire generations who've grown up without cannabis being legal, for example. They've still started smoking it. So I don't see why this would be any different in that respect. And I think it's really, it's quite disingenuous, I think, from supporters of this legislation to be framing this as protecting young people, as protecting children, when this legislation isn't going to affect them until they're adults. There are lots of things that are dangerous, that are bad for you: alcohol, chocolate, lots of extreme sports that we say to adults, it's up to you to decide whether you do them or not.
I take your point, and let's just put that to you, Hazel. I mean, Jack's got a point, hasn't he? If they come for a carver, for example, then I'm in trouble.
Well, I think we have to be clear here. We are talking about a really unique product. It's not a question of, we dislike smoking. Smoking is killing 2 in 3 long-term users. It's still the leading cause of preventable death. It's the leading cause of difference in life expectancy between rich and poor. This is a unique product. And these other products that cause us harm, I'm not saying that those products are not worthy of regulation and making sure that we, limit the ability for them to do the population harm. But I think the approach, nobody's suggesting that we take the kind of approach that we're looking to take with tobacco. This is a uniquely harmful product that warrants a very specific response. And the goal, which is clear from this government, and the opposition is also echoing it, is this isn't about saying, just the next generation, won't be able to smoke. This is about part of a gradual move towards making this country smoke free. So it's consigned to the history books. And the government has also, to their credit, put quite a lot of resources in to helping current smokers to stop. And, bring these things together. I think in 20 years' time, we will look back and say, goodness me, thank God no one's smoking anymore.
Well, it's funny, Fia and I were talking earlier about how things used to be in the back of cars in the 1970s when we'd all be, as kids, bobbing around, annoying our mum or dad, whoever was driving. The idea of seatbelts was complete anathema, and people did moan when the seatbelt regulations changed. But we have got used to it, haven't we, Hazel?
Well, and time and time again, I think you can go all the way back through the kind of history of public health interventions. When they were trying to sort the water systems out, people were complaining about having safe, clean water foisted on them. This is the history of public health interventions, is that people are, there are a vocal minority that complain. The majority benefit when these policies come in, and they have masses of support. This policy already has 2/3 of the population supporting it. I mean, that's higher than the proportion who were supporting smoke-free legislation prior to its implementation.
Thank you.
Support for smoke-free legislation is very high now, but yeah.
Sorry to interrupt, Hazel, but thank you very much. Hazel Cheeseman, Deputy Chief Executive for Action on Smoking and Health. And you also got the view of Jack Rowlett, political commentator with Young Voices UK.